Hello everybody, I am Dr. Kajal Ghosal, Homeopathic physician. Welcome to my YouTube channel Dr. Kajal's Clinic. This is my small effort to reach homeopathy door to door and daily life for everyone. Today my topic is on depression. Depression is a small word to say, but it is very hard to deal with. Even the treatment is very complicated. Depression is serious mental illness which involves brain function. It is a silent killer also because we can't recognize their symptoms or them. So the cases are going worse day by day. Depression is mostly characterized by persistent low state of mood, unhappiness, sadness, and a sense of despair. More than 264 million of people of all age groups and from all professions are suffering from depression. So it is called major depression disorder, MDD, or high functioning depression, HFD. Depression can affect a person's feelings, behavior, thoughts, motivation, and sense of well-being. It may persist and interfere your everyday's life. Depression could occur anyone, any point, anywhere. Many pupils surrounding us are suffering from depression, but we can't recognize or identify them because we generally ignore their symptoms and ignore them. Most of the pupil concentrates his physical symptoms, physical health, physical illness, but mental health, mental illness, mental symptoms are equally important. In India, 10% of our populations are suffering from depression, and this number is increasing day by day. So, scientists are doing research on this topic. Possible causes are combinations of biological, social, and psychological sources of distress. First, we see what are the biological causes. Persistent stress, unhappiness, sadness, suppression of grief can affect a person's brain chemistry, which can changes the balance of hormones like serotonin, norepinephrine, and dopamine. It can also affect during exchange of neurotransmitters at the synaptic cleft, which induces the ability to maintain the mood stability. Now number 2, social causes. Death of a spouse or loved one or any close one, breakup in love, financial loss, losing a job, losing court cases, facing troubles after marriage, after retirement, getting divorce, any type of abuse, physical, sexual or emotional, abuse to certain drugs, certain medications. Now number 3, psychological causes. Personal conflicts, any disputes with family members, with close relationships or within the close friends. Prolonged torture from childhood, prolonged dishonor from classmates, from office colleagues. Varieties of reasons are responsible for depression. Major depression, you feel depressed most of the time, most of the days of the week. Bipolar depression, mood swings, frequent mood change from happiness to sadness. Childhood depression, few children are also suffering from depression. Adolescence depression, it happens during adolescence period. Most sensitive age, guardians should take care of them. Old age depression, it is seen in aged pupil. Psychotic depression, it happens at any age. Seasonal affected depression, mostly seen in winter season. Premenstrual depression, depression before menstruation. Postmenopausal depression, depression after menopause. Postpartum depression, depression after childbirth. Common symptoms of depression are sadness, unhappiness, low state of mood, loss of interest to anything, lack of energy, lack of confidence, lack of concentration, lack of pleasure, sleep disorder, insomnia or lack of sleep, hypersomnia or sleep more than usual, appetite disorder, loss of appetite or terrible eating habits, any type of social withdrawal, deny to meet any pupil, deny to join any social party, anxiety, nervousness, tensions, fearfulness, feeling of self-condemnation and utter worthlessness, hallucinations and illusions, addictions to mobile phone and computer work, talks of committing suicide always, and suicidal tendency. Now the part is diagnosis. Pupils from all age groups, from all professions, TV stars, film stars, dancers, singers, students, aged people, all are suffering from depression, but we can't recognize them or their symptoms because they have a tendency to hide their symptoms. They are suffering too much inside, but outwardly they are acting. They are showing that they have no problems, they are smiling. Even they feel very bad when asking for any help. They are telling that they have no problems, they can handle it, they can manage it. So, diagnosis is very difficult for this pupil. This type of pupil should consult with doctors, psychologists or psychiatrists. Now the very important part is treatment. It is divided into two parts, counseling and medications. Being a homeopathic doctor, we can manage both counseling and medication because we first deal with mental symptoms, mental health, mental illness. Then we go for physical symptoms. So we are also expert on counseling. My advice, particularly for counseling, speak and share your sufferings, your problems, your experience with your family members, with close friends and close relationships. Feel only present, which is a gift for you. Forget about all past, which is a regret part, and future, which increases your anxiety. Filter your thoughts. Remove or delete all negative thoughts. Be positive, so think for only positive thoughts. Appreciate and congratulate yourself for your every job and work. You must tell yourself, I am strong, I am powerful, I can do everything. Time is very valuable for you, so don't waste your time. Life is a gift for you. It offers us privilege, opportunity, responsibility to give something back by becoming more. Surrender yourself and accept your current situations. Eliminate your all unhealthy relationships. Find a new passion and hobby. Keep fighting, never give up. Increase your self-esteem. Improve your skill communications. Believe in hope. Your failure can be turned into a success. Change your lifestyle process. Do meditation at least for 10 minutes and do physical exercise every early morning at least for 30 minutes. Eat healthy food and healthy drink. Improve your sleep. Now the part is medications. There are so many homeopathic medicines which are very useful to treat depression by constitutional and symptomatic treatment. Here today I discuss only 10 medicines by which I usually get good results. Number 1, alumina. Impulsive, moody, mostly seen on young generations by cutting their veins. Very furious on seeing oozing blood. Number 2, anacardium. Lack of confidence, lack of concentration, lack of pleasure, brain fat, forgetful, impaired memory. Number 3, antimicrote. They are very introverted, sentimental, emotional. Most of the symptoms coming from breakup in love, financial loss. Number 4, argentum nitricum. They are very violent, suicidal tendency, tries to jump from window, roof, from train, from heights. Number 5, aurum mate. They are also introverted, moody, suicidal tendency, talks of committing suicide always. Number 6, carbonium sulf, sluggishness of mind, dementia, mood swings, constantly changing mood. Number 7, ichthyolum, very forgetful, nervous, irritable, depressed mood. Number 8, ignitia. This medicine is very important for depression. They are sad, not communicative, constantly sighing and sobbing, silently brooding. Number 9, netramune. This medicine is chronic of ignitia. They are very angry, easily irritable. Consolation aggravates all the symptoms, wants to be alone, to cry. Number 10, sepia. They are very sad, tearful, introverted, indifferent to family members, aversion to occupations, easily offended. Thank you for watching this video. For more information about this topic, please go through my description box and you can find there my personal WhatsApp number for your private consultation. If you need any homeopathic treatment for any type of disease or sufferings, you must subscribe my channel and press the bell icon. Do share my video to your contacts and give me a like if you think my video is helpful. Please mention your complaints, sufferings or problems in my comments box and I will reply to them as soon as possible. See you on my next video.